So there are many, many reasons people get divorced, but they all basically boil down to the same concept. One or both are unhappy in the marriage for whatever reason, whether that is, it could be anything. And we all know that unhappiness can lead to depression. And so in this podcast with my wonderful guest, who I'm going to introduce in a minute, we are going to talk about depression, the signs of depression, what depression looks like versus just sadness and grief. And then which came first? Were you depressed and that possibly contributed to the cause of your divorce? Or did you get divorced and did that cause the depression? So I have a real expert guest today. Her name is Brittany Baker. Brittany is an LCSW, a therapist, and the founder of her integrative therapy practice called Nix Baker Wellness and Therapy. Hi, Brittany.
Hi, how are y'all?
Good. So this is the first time we're talking with you being now based out of Colorado. So I want to tell my listeners, Brittany was in Illinois. She now is in Colorado, but she's licensed in both states as well as some other states. Tell me if I'm right. Texas, New Mexico, Arkansas. Am I missing?
Close, close,
Okay.
close. It's Texas, Illinois, Arkansas, Kansas, and now Colorado.
Kansas. Okay, got it.
Yeah.
So Brittany wrote this wonderful article for Divorced Girl Smiling that you can find on divorcedgirlsmiling.com called Depression and Divorce, Which Came First? So Brittany, tell me the difference. What's the difference between, like, how does somebody know if they have depression versus just being really sad or suffering the grief of a divorce? How do you know?
Well, I'm really glad you asked this question. And I just want to make a comment that I think it's important to think about this because there's a lot of information out on TikTok and social media and people who are not experts telling you this is what depression looks like. But grief can look a lot like depression, and depression is actually part of the grief process. The key pieces are, though, that this is impacting you more days than not. So in a week, it's impacting you 4, 5, 6, 7 days. And it's having like negative impact on many different aspects of your life, whether that's relationships, professional, like your personal hygiene, your own health. We can feel sad and still function, and that's not necessarily depression. So whenever we're talking about like a clinical depression, we're talking about that at least 2 weeks long, at least happening 4, 5, 6, 7 days a week, and impacting other areas of your life in like very negative ways.
Okay, now, with all due respect, when you're going through a divorce, you could feel that way for weeks. But Brittany, I think what you're trying to say, and tell me if I'm right on this, is that, in other words, 2 weeks every day, all day. So when you're going
Exactly.
through a divorce, you could be depressed for a few days because you just found out that your soon-to-be ex has a girlfriend. So then, like, you
Right.
can't get out of bed for a couple days. You're so upset. But then you're able to go to work on Monday, function. Is that kind of the idea?
Right, right. And you're also thinking about like a very intense sadness. You're thinking about this severe lack of motivation. Like it's hard for you to like get through your day to day. Depression is really like a collection of symptoms that have that severity attached to them, right? Like of course, a lot of people talk about losing weight going through or gaining weight going through a divorce, which also could happen with depression. But you that might happen along with this like lack of motivation, this lack of ability to feel joy, this lack of ability to enjoy other aspects of life. And something that I hear from some people who are going through divorces is they are dealing with all of this chaos, but then they get those few moments to spend with their kids, and they're like, okay, like I can look forward to this. Whereas with depression, there's not going to be much that you can look forward to or enjoy.
Okay, another couple examples I'm thinking of are these divorced women, and I'm saying these divorced women myself when I was getting divorced. You would look forward to going out with your girlfriends and you would, yeah, you might cry when you're with them, but at least you went out. If you're depressed, maybe you're just canceling all plans and not doing anything.
Right, right. And sometimes people with depression will also describe a numbness, which gets a little tricky too, because in working with some of the people going through divorces that I work with, they also express a numbness. But again, that numbness is more long term and more global, right? It's not protective so that you can sit in mediation or sit with your lawyer. You're going to feel this kind of across your life in many different areas.
Now, what if somebody's listening to this and they're not sure and they're like, I don't know if I have depression or if it's just this divorce? I mean, you just gave the symptoms, but who can they ask? Can a therapist diagnose you?
100%. And I always encourage people to, if you have a hard time getting in with a therapist or a psychiatrist, you can always start with your PCP, though, they're expert, they're not experts in one thing. They know a lot about a lot of things. And so they may use kind of these standardized questionnaires that can give you false responses or false positives or false negatives. And so I always encourage, like, go talk to a therapist, because here's the thing is, even if you're experiencing this lack of motivation, but maybe your appetite's fine and your sleep is fine, or you're just so sad, having that outside support and that unbiased opinion can be like so helpful.
Now, the other thing is, what do you do if you're diagnosed with depression? Of course, therapy, possibly like medication, but you might have to
Mhm.
go on medication just temporarily during your divorce. I mean, I know that I
Mhm.
have had situational depression where I went on a medication just for a few months. And then, like, I'll give my listeners an example. At the start of COVID, I had so much anxiety about getting sick and dying with good reason. It was a scary time for everybody. But I lost 10 pounds in the first 2 weeks. I mean, geez, I wish I could have kept it off. And I couldn't function. I couldn't sleep. I was crying a lot and I went on medication and it was a huge help. And I stayed on it for about a year and a half and then I went off.
Yeah. And I think that that's true for a lot of people. And I like to describe medication. Some people are all about medication and that's the only thing that they want to do. They look at it as like the end all be all. And then some people are very, very hesitant to take medications. But the one thing that I like to say about medications is medications don't change your environment. They don't change who you are. They just make the load lighter so that you can do the things that you need to do to function, to cope, to help yourself get out of that rut. Like I said, I described it as kind of like you're wearing a really heavy backpack and trying to walk up a hill, and the medications can make the backpack lighter, but you still have to walk up the hill and carry the backpack.
Oh, I love that. And also, I'm a huge proponent of medication, but with added holistic things too. So, a pill isn't going to just make everything all better.
No.
Like, there's other things you can do to make it much better, such as meditation, yoga, talk therapy,
Mhm.
walking, whatever it is, but try to do both, not just rely on just medication or just rely on the yoga and think that's going to be enough.
Exactly. And actually, if anyone's ever interested, if you look at the psychological research, people have a kind of across disorders for the most part. There's a few that are outliers, but across disorders, people have the biggest success in less relapses whenever they combine the medications with some sort of therapies. Whether that, sometimes people think of yoga as a form of therapy, but you're combining those medications with therapy, and that idea is supported in the literature.
You're listening to the Divorced Girl Smiling podcast. My name is Jackie Pilosoff, and I'm your host. And today I'm here with LCSW and therapist Brittany Baker. Brittany is the founder of her integrative wellness and therapy practice called Nix Baker Wellness and Therapy. Brittany has been a therapist, I want to say a decade, Brittany.
Yeah, a little over a decade, but yeah, a while.
And Brittany and I are talking about depression and divorce. We're going to take a short break. And when we come back, we are going to get into depression and divorce. Can divorce lead to depression? And can depression lead to divorce? We'll be right back. Welcome back to the Divorce Girl Smiling podcast. My name is Jackie Pilosoff, and I'm your host. And today we are talking depression and divorce. Which came first? My guest is Brittany Baker. Brittany is an LCSW, a therapist, and the founder of Nix Baker Wellness and Therapy. So, Brittany, can you understand why people might not really know which came first? They might say, well, did depression contribute to why I got divorced, or did I just get depressed after the divorce? How do you know?
Yeah, no, I think that I totally can see it. It's actually really funny. I was listening to a comedian the other day and he said something about getting married a second time and how there's so much pressure that if he gets divorced again, then he has to truly think about himself and is there something wrong with him? And it's funny because when you're going through this process, it's hard to know like where did you start and stop this sadness and how did that impact the relationship. So I think it's a very fair question and I'm sure a lot of people consider.
All right, so let's start with this. Can divorce lead to depression? So let's say that you were relatively emotionally healthy. Your ex came home and said, I don't want to live with you anymore. I'm in love with someone else. Can that lead to depression?
100%. I mean,
Even if
if we
you're really emotionally healthy?
100%. I mean, I think that an experience that I hear about a lot from many women is feeling blindsided by these kinds of things, especially when you're at home, you're taking care of everything, you have kids, like things seem okay, and you come home, your partner comes home and they're saying these things to you. It can shake your foundation, shake this idea of who you are, your identity, make you feel worthless and helpless, which are all parts and symptoms of depression.
Okay, so when you were saying, they're blindsided, it's almost traumatic. And trauma, if not dealt with, I think, I mean, I'm not a therapist, but if you don't deal with it, it could lead to depression. So maybe it's important to really e- understand your trauma, where it's coming from, and how to cope with it. Because, like, I know someone whose husband left her like 15 years ago, and I do not believe she's ever really gotten over the trauma.
Right. And in some of those cases, kind of depending on what those people are experiencing internally, there might even make the case for like a PTSD type diagnosis.
Yes, for sure. Okay, what about people who are in a marriage and the person suffers from depression? Okay. And, maybe they aren't like, I don't want to say full blown, but like they're not like, it doesn't define them and it's kind of gradual. What are the difficulties that couples have when one or both people are suffering from depression?
Right. So if you just kind of think about the symptoms of depression, right? There's this lack of motivation, this lack of ability to feel joy, like you're not engaging in life. Sometimes people have like brain fog or poor hygiene. They're gaining weight, they're losing weight, they're sleeping a ton. I mean, if that's what you're experiencing, it's hard to show up for a relationship. Like relationships are a lot of hard work and they take a lot of mindfulness and ongoing growth. And if you're feeling this way and can't engage in normal life or very internal, then there's no way you're going to be able to adequately provide to that relationship baby, as I like to call it, right? Like you can't really care for that relationship as it needs to be cared for, and the relationship will deteriorate.
Mhm.
And if one partner feels depressed and the other doesn't, sometimes the partner that is not depressed feels like they're parenting or like kind of trying to drag this person along. And I oftentimes hear a lot of frustration about why can't you just get help? Um, and unfortunately, mental health issues are oftentimes like substance abuse issues, and we can't force someone to stop drinking or to get help. We can make requests, but that doesn't necessarily equal action. And that can be really hard. And again, whenever one partner is like parentified in the relationship, that also doesn't lead to a lot of connection. It oftentimes leads to a lot of anger and resentment.
Oh my gosh. I was thinking everything you were saying, like, you're 100% right. And when people feel frustrated because the person won't get help or they've tried everything and nothing's working, they can start to get resentful and bitter and feel hopeless and just say, you know what, it's probably better if we cut ties. So I know that there's never any judgment when I hear about people getting divorced for whatever reason, because everybody has to do what they have to do and what they think is best for them and their kids. But one thing you wrote in the article that I thought was interesting, where you wrote, difficulties I see between couples with one or both partners struggling with depression include, okay, you listed them here: feeling unloved or uncared for or unheard, feeling emotionally disconnected, having anger issues, maybe a little paranoia, like you feel like your partner's hiding something because maybe you're insecure because of the depression,
Mhm.
avoidance of issues in the relationship or other areas of life, job difficulty. Maybe somebody's depressed and they lose their job. Well, now you have all these financial issues that are coming up. Another one was difficulty managing conflict. You know, what if you have kids and your child is getting into trouble and you're just not able to cope because of your own depression? And then, of course, alcoholism and substance abuse. So, marriage is hard enough as it is, and when you add depression into it, it's just 10 times harder. But Brittany, don't you think people can get help? Like, have you seen people who had depression get help and then everything gets much, much better?
100%. Like depression, anxiety, oftentimes there's traumatic stuff or even things that that we call big T or small t problems, that when we address those things and we build insight and we take care of ourselves, we are much more likely to be able to contribute to a relationship positively. um and it's that age old thing that you have to take care of yourself before you can like give to other people or take care of other people. And there is hope, and there are professionals out there, whether that be your PCP, your primary care provider, you're a psychiatrist, a therapist. Coaches don't typically shouldn't really cross over whenever you have like an actual diagnosis, but like coaches in some scenarios can also be helpful, especially if you're looking to make like kind of action oriented steps forward. But I will say it does sometimes require taking a bite of that humble pie to reach out for help.
Yes, it's not easy to admit it and it's not easy to do, but I love that there's hope for this. And what I want to ask you is, like, do you ever have someone who says, look, you know, I am going through a divorce. I'm really sad. I really have so much grief. I cry all the time. And I mean, I'm sure that's what everybody says that's going through a divorce. But what do you say to them if they don't really know? Like, do you think somebody's gut will tell them if it's more than that?
I think so. Like, because oftentimes, I mean, many people have experienced some sort of loss and like have been through some sort of grief process. And I know that divorce is oftentimes one of the more traumatic things that can happen in someone's life. Um, but I feel like we oftentimes can feel it in our gut, if like the difference between like this is something that I'll be able to move forward with and something, or something that I'm stuck on and that there's nothing that I can do that's shaking this loose. And so when I am working with people who come in who feel this uncertainty around like what's happening, we have a lot of conversations around what they're experiencing. We'll give recommendations on behavioral things to do, and sometimes medications or at least going for an evaluation is recommended. And but if they start doing these behavioral things and over 4, 5, 6 weeks there's not any changes, then that might also be indication that this is a little bit more than just like grief or sadness.
Right. Okay, I want to end this on a really positive note. And then, Brittany, you're the therapist, but I want to see if you agree with me and then expand on it. Having depression is not a character flaw. It's not that you have something wrong with you. It's something that is manageable and fixable, with the right professionals, with the right medication, and there should be no shame or judgment of any of this because it is something that isn't in your control that you got the depression. Tell me about if you agree with that.
I like 100%. I mean, the stigma is one of the bigger things that I have to fight as a mental health professional. And, it is something that is treatable. It is something that if you need be, you can take medications for, but not everybody needs to. What I really tell people is that like if, without reaching out for help, without talking to someone, all you're doing is perpetuating this problem. And my guess is that you for a lot of people, if they would have reached out sooner, they may not be in the place that they're at whenever they finally come to my doorstep. And so be preventative because we can have like just sadness and grief and have the blues without it being full blown depression. But if you let that go too long and just keep kind of digging that hole for yourself or letting it snowball, then it can turn into depression. So be proactive and talk to someone, talk about ways we call it behavioral activation, where you just kind of get yourself going, right? Like, what are those small, tiny baby steps so that you don't keep falling backwards? So be preventative. And like you said, it's not anything to be ashamed of. Quite honestly, like, I don't know if you guys have seen the statistics lately, but it's quite startling how many people actually suffer with depression, anxiety, or some other kind of mental health disorder in this day and age.
Well, it's very interesting because the elder generation, the old way, they'd say like, toughen up, come on, get tough. And I think that's a good thing to say to someone who is already getting help for their depression. Okay, that's a good motivator and come on, because therapists and pills don't solve your problems. What does is time and doing the best you can to solve them. Really. I mean, like so many people will say, oh, my boyfriend and I broke up and I'm so depressed and I feel like I need therapy. You're not going to a therapist so that they can make you feel better about your breakup. You're going to a therapist to take care of your emotional health during the breakup to make sure that you are okay moving forward and that you can have a healthier relationship in the future. Does that sound accurate?
That sounds accurate. And it makes me think about that idea of resilience. One of the biggest protective factors against and also being widely researched in the mental health field is resilience. Resilience is that idea that like bad things happen and things suck sometimes. And you take those experiences and how we think about them and how we process them and how we integrate them into our lives and learn from them and allow them to make us stronger. That is resilience. And that is one of the biggest protective factors against mental illness. And in therapy, that's a lot of what we're doing is we call it cognitive restructuring. So trying to look at these challenges, these things that we experience in our lives, to look at them in different ways so that we can be resilient and grow from them and find strength in the things that we've learned, and that will help us as we move forward in our lives.
Brittany, thank you so much. I cannot believe that we are out of time. That went by so fast. I really appreciate you taking time to be on the show. Tell my listeners the best way to reach you if they want to have a consult or hire you.
Of course. So the best way is nixbakerwellness.com, and you can submit an online form and I will get in touch with you normally within 24 to 48 business hours.
Okay, and it's NIX,
NIX.
nixbakerwellness.com. And you can also find Brittany in the Trusted Professionals section of Divorced Girl Smiling, which is divorcedgirlsmiling.com. And along with Brittany, you can find so many other wonderful, trusted, vetted divorce professionals like lawyers, mediators, real estate agents, mortgage lenders, financial advisors, and more. And you can also go there to read articles, listen to more podcasts, download my mobile app, or sign up for my free consult. Thank you so much for being here again, Brittany.
Thank you, Jackie, for having me.
And thank you, everybody, for listening. We'll talk to you real soon.